Hi, Dr. Saxena here, and let's talk on something on what is this. And this will be a series of what I try to understand from what is this thing called COVID-19, and we have been on record trying to work it out. What are the kind of how we can always best supplement things, and what are the areas which a normal person should know, so that he can always take some of the clues where he can always get away with the nasty problems. So, as a doctor trying to work on nutritional medicine, I can always talk about what are the supplements which, apart from the things which have been told, we have been always emphasizing on trying to see that you, the person who has got a good immune system, and he is not getting into some problems. Here, I just want to tell you about it is not just the low immunity and all that. We are just trying to see that the Th1 and Th2 balance of the immune system is balanced. If it is not balanced, and it is because of so many things, the first thing is your there are chances of overdrive are more when you have got something like this. If you have got a skewed immunity, so what are the things which you have been talking about right from the inset, when we started working on this COVID-19 for the last 18 19 months now. And it is we have been emphasizing on vitamin D. What are the things which we would like to do? We are talking about vitamin C, what is melatonin and all that. I can always tell you, if someone comes to us and what are the other things he should consider, I would like to tell you there is something like N-acetylcysteine which has to be considered, something like zinc we have been talking about, quercetin, you have got vitamin B and all that. So before that, I just want to give you a concept of what does thing called NNT, number needed to treat. There is a study which showed the number needed to treat. This is one thing. There was this study was done for influenza virus, and see, this viral replication. What we are talking about, including in this one study, the number needed to treat was 0.5 when we took something like N-acetylcysteine. So for that means for every two people treated with NAC, one will be protected against the symptomatic influenza. So on that basis, I just want to tell you, it is we are talking about this with NSC is this NNT number is zero point 0.5 is quite good, because what we normally get with influenza vaccines is the NNT number is 71. So meaning 71 people must be vaccinated to prevent a single case of confirmed influenza. It is NAC, it's even better than vitamin D, in that the vitamin number is 33. So the 33 people has to be given this vitamin D, so that one will not get into this one. So we have been talking about vitamin D in a big way, and so I can always extrapolate what is being having with that virus, which is a influenza. We can always extrapolate to COVID-19 also. So this particular thing gives me a more kind of thing, which I always we believe that this is the COVID-19 is affecting people who have glutathione deficiency. Glutathione is an intrinsic thing, antioxidant, which is probably, and most of the healthy people, the people who are more healthy, they have the good intrinsic glutathione levels. And people who are on antibiotics, people who are on drugs, people who have some autoinflammatory problems, so many, these are all the people who has got low glutathione levels. And it has been shown this is not COVID-19 is really problematic when your intrinsic glutathione levels are low. So what we are talking with this N-acetylcysteine is a precursor of glutathione, and once this precursor of glutathione, it tries to improve that particular stuff. And with the NNT value of zero point 0.5, I think this is one of the best things which I could ever prescribe. I can always tell it is over the counter it's not a drug, it's just a supplement. It's a kind of something like vitamin. It is just a you can always use that particular thing in a big way. So this what happens is this uh, NAC has been shown to inhibit the damaging cascade associated with cytokine storms, and which is a major cause of COVID-19 death. So helps in NSC helps in the COVID-related lung problems, including pneumonia and other stuffs, ARDS, and this is how we are trying to. And apart from that, we were baffled when we started getting that clots and all that. Everyone has got that serious clots, and it not only NSC not only contracts with hypercoagulation, but it also breaks down the blood clots once they have been formed. That is the kind of thing what although we try to work with some enzymes also. So in the paper which was presented in 2020, medical hypothesis, the NAC could act as a potential therapeutic agent in the treatment of COVID-19 through a variety of potential mechanisms, including increasing the glutathione, improving T cell response, and modulating the inflammation. So there are big number of things which I always try to see what is the immediate thing which I can work it out. With that, there will be some kind of substantial change what we look at the through in the outcomes. So for me, this is one thing which is a easily available stuff, which is called N-acetylcysteine, and it's always a it comes in the definition of a dietary supplement, not a drug. So this is one thing which I thought I'll just share with you, and this is how our approach with dealing with trying to work out with all this viruses and all. And I'm sure there are many more things will come, because but once we have your defense mechanisms working well, whatever is it, you will not get it into fall into the kind of situation where things will be out of control. Thank you.